Hello everyone, I am Dr. Beatrice Vision, and recently I saw a patient that came with badly decayed tooth, and it's actually due for extraction. But the patient was actually rejecting the extraction because he heard stories and he believed that some people died while having extraction or after having extraction. Well, dentistry is now so advanced that death occurring due to extraction is very uncommon. Well, and even if it happened, it's usually not due to the extraction, but due to secondary problem that the patient already had. That is why it is very important for us as doctors that when a patient comes to us, we first take what is known as history. So history is a form of having a conversation with you as a patient to assess your level of general health. So when you come, we begin to ask you some certain questions about your name, what you do, and your behaviors and all that. Now we are not trying to know your secret or whatever. We are trying to know about your health so that whatever procedure we want to perform on you, it should be safe for you, not just for us. So when you see your doctor or any of your dentists asking you a question that is not related to your oral cavity or your teeth or any structure within your mouth, it's not that he's trying to know your secret or something. He knows what he's doing, because some patients come down with uncontrolled diabetes, uncontrolled hypertension, some have bleeding disorders, some patients don't even know their genotype. And whatever procedures we want to do, it's an invasive procedure, so we don't want to cause more problems. So in those cases whereby patient now have extraction and then he goes back home, the place get infected or there's uncontrolled bleeding, these are some of the common cause of complication and mortality that is associated with tooth extraction. So I will advise you that when you notice any form of cavity in your teeth, it is best to visit a dentist. Or when you start having mild tooth pain without noticing a cavity, you visit a dentist. Because if you look at the teeth and the oral structures, they are closer to your brain, they are closer to the neck, and they are closer to your chest. Now, these places I mentioned, there are vital organs within those areas that any infection of the teeth, it can go to the brain, it can go to the neck, it can go to the chest. And the chest, this is where the heart is. It pumps blood. So any infection that goes down to the heart is now resulting to systemic problem. So it will go through the blood and it spread all over your body. Some patients don't even present to the hospital until they've been having severe jaw swelling, or when they start having problem with the breathing. Now, those cases, they are already complicated. Despite the fact that you only have jaw swelling, some of the abscess might have extended to your neck or to your neck. These are complicated cases and need aggressive treatment. So the more you delay, the more there's high chance of having mortality. Now, local anesthesia that we give to numb pain before we do any procedure, some of them have some substances inside that predispose the patient having allergy reaction. However, most of the local anesthetic agent we use now, that substance is already removed. So we even ask patient whether he has any procedure before that predispose you to having allergy or something, so that we prevent, you know, always we don't use uh, that agent or any medication that you were reacting to. We will not give it to you. So it's not just okay, to stay back because of stories that you heard that a patient died while visiting a dentist. So when you come to see a dentist, you make inquiries, you get counseling, they allay your fear and anxiety. We don't just bring you up and put you on the chair and start extracting your teeth. No, 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 no. We don't just extract it. You understand? We counsel you. There are a lot of procedures we do in your oral cavity that is not just extraction. Most of the condition you come down with might not even need extraction, maybe just a simple filling, and then you're home and dry. So it is good that you culture the habit of visiting your dentist. Yeah. So happy day and make sure you enjoy your moment. Bye.